Are you looking at your thyroid labs and wishing you had a nice overview of thyroid function tests? My name is Dr. Taranella, and in this video, we're going to do just that. We're going to look at TSH, T3, T4, reverse T3, and thyroid antibodies. So this is an overview of thyroid function tests, what you need to know. Again, my name is Dr. Taranella, and if you're new to this channel, I just want you to know that I'm making these videos to help you go beyond the basics of your health, whether it's a confusing lab test, symptom diagnosis, or other random medical facts. I make these videos to help you get a better understanding of what's going on with your health. So if you like this kind of information on nutrition, hormones, lab testing, etc., click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer, the information in this video is for informational purposes only. It's not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deeper your understanding of your own health and treatment success. If medical attention is needed, don't delay in seeking that attention. All right, let's check out this topic on thyroid function tests. All right, so here we're going to look at an overview of thyroid function, and these are some of the things that I think are important to know and understand when you're looking at your thyroid labs. Usually your doctor will kind of go over these things with you, but if they're not, you can use this video as kind of a template to understand what's going on with your thyroid. So your thyroid gland is located right here, and it produces hormones like T3 and T4 that regulate things like metabolism, heart rate, body temperature, and even energy levels. So when your thyroid gland is not functioning properly, it can cause problems with these, which would manifest in symptoms related to those things that I regulate. So could be body temperature, could be heart rate, could be metabolism, could be energy levels. One important thing to note is that this is an overview of the test. So we're not going to get into the finer details, but I have done other videos on this topic that go into more depth. But also we have to understand that these are just tests. So they don't really necessarily tell us specifically what kind of symptoms you might be having or the degree to how bad your symptoms are. That can actually inform us on how to proceed forward with treatment and what to do as far as like how often to test and things like that. So some of the common thyroid tests will include a TSH, a T4, a T3, and a reverse T3, and sometimes thyroid antibodies. So the first one, TSH, is thyroid stimulating hormone, and it's produced by the pituitary gland, and it stimulates the thyroid to make thyroid hormone like T4. A high TSH level means that your brain isn't getting enough of that thyroid hormone and it's asking for more, so it's going to increase the TSH output to stimulate the thyroid gland to make more. So when that's happening, this is referred to as hypothyroidism. You will have a high TSH. A low TSH, conversely, suggests a hyperthyroidism, also known as overactive thyroid. T4 or thyroxine is one of the main thyroid hormones produced by the thyroid gland, and we sometimes measure something known as the free T4, and this is the amount of unbound or bioavailable thyroxine floating around in the blood. A low free T4 can indicate hypothyroid or underactive thyroid, while a high T4 suggests overactive or high thyroid. Same kind of thing with the free T3. The T3 is converted from T4 into T3, and it's one of the two thyroid hormones. The free T3 is the amount that's bioavailable or unbound and ready to be used. The T3 and the free T3 both are the active form of the thyroid hormone, and they're produced by cleaving one of the iodines off of the T4, and that gives you the T3. That's usually done in the peripheral in the tissues themselves. So a high T3 or high free T3 would indicate hyper or excess thyroid hormone, and a low T3 or free T3 would indicate hypo or not enough thyroid hormone. The next thing in the overview of thyroid hormone labs is thyroid antibodies. So these antibodies in general are proteins that are produced by the immune system to attack specific tissues. And sometimes the immune system can make a mistake, and this results in autoimmune disease. In this case, these autoantibodies to your thyroid are part of a broader autoimmune condition. There are different autoantibodies to the thyroid, some of which can cause increased thyroid hormone output, some of which can cause decrease thyroid hormone output. And they result in things like Hashimoto's and Graves' disease. Reverse T3 is the last and final thyroid function test to discuss. And this molecule is produced instead of making T3. So when your thyroid is producing the T4, it then has two distinct pathways it can go down. It can make the T3 or free T3, or it can make this reverse T3. The reverse T3 is not really active and doesn't really turn into, there's no way for it to turn back into the T3 or the T4. So it's kind of stuck in there and eventually will get degraded in its unused form. This process is thought to increase where you make more of the reverse T3 when the body is under more stress, whether psychological or physical. Could be like inflammation going on in the body, or you're just psychologically stressed from work or even chronic health issues. So as I said earlier, it's important to note that these tests themselves, these thyroid function tests, are not conclusive in and of themselves. So you kind of have to mix and match the tests that you're doing to get a complete picture of this. And sometimes if it's sort of on the borderline or the person's asymptomatic, we may do the test at least 2 times before we make a decision on what we're going to do for that person in terms of treatment of the thyroid problem. All right, that should give you a better understanding of the overview of thyroid function tests. Hopefully it does. If you still have follow-up questions on this topic, definitely drop it in the comment section. I'm happy to answer your question. Thank you again for watching. We'll see you next time.